Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
This is Dr. Angela, everyone's favorite OBGYN, and I would like to welcome you to episode 2 of the Ask Dr. Angela podcast, where we discuss fashion, family, politics, and a sprinkling of medicine to top it off. I keep it light, I keep it fun, I keep it very simple. Before we dive right into things, I'd like to thank you, the listener, for joining us today. Today's question comes to us from Amber.
What are the general risks involved in going VBAC, and what are the risks involved in having a repeat C-section?
Amber, that is an excellent question and one that I get asked quite often. Risk associated with VBAC, risk associated with a C-section. Well, let's start with the VBAC, or for those of you who aren't familiar with that terminology, vaginal birth after a C-section. The major risk that's associated with VBAC is going to be uterine rupture. And even though that occurs less than 1% of the time, it's a really big deal. Uterine rupture results in an emergency C-section. The nice thing about a VBAC is that if you are successful in having a vaginal delivery, then there's less bleeding, less recovery time, faster discharge from the hospital. However, if you are attempting a VBAC and you are unsuccessful and you end up with a C-section, then you are certainly going to be at an increased risk for infection, bleeding, longer hospital stay, longer recovery, etc. Now, when we talk about a C-section, a lot of times we're so cavalier about C-sections, a lot of us don't realize that a C-section really is a major surgery. And as with any major surgery, the risks that are going to be associated with that are going to be things like bleeding, infection, longer recovery time, longer stay in the hospital, potentially injuring baby at the time of the C-section, potentially injuring neighboring organs at the time of the C-section. Those neighboring organs are going to be things like bowel, bladder, ovaries. Now, Amber, I hope that I have not confused you too much, but I think that it's really important if you are someone that has previously had a C-section to have a really in-depth conversation with your obstetrician and gynecologist or your OBGYN to see if you are going to be a good candidate for VBAC. I certainly hope that this has not confused you too much, Amber, and I'm really hoping that this has somewhat answered your question. I'd like to personally thank you so much for taking the time to submit your question, and because we did use it on the air, my assistant will be reaching out to you and gathering your information so that we can send you an official Ask Dr. Angela t-shirt. Pretty bomb-ass t-shirt, if I might say so myself. For those of you that are listening, if you have a question that you would like featured on the show, you can go to askdrangela.com. That's askdrangela.com. You can ask your question right there on the home page. Click on the microphone on the right-hand side of the page and leave your question. And if I use your question on the air, I'm more than happy to send you a t-shirt as well. In closing, we're going to end the show with a quote by Brian Tracy, and it reads as follows: "You can only grow if you are willing to feel awkward and uncomfortable when you try something new." Until the next episode of Ask Dr. Angela, look better, feel better, be better. Have a good evening.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.